unfortunately, the 26th Chronicle reporter here.
Okay, there may be at the end. And John and everybody else, just whenever you guys are ready, you just let us know and we'll be happy to get started.
There's no one else in the lobby. We're 2 minutes early, but Chief, if you want to start, we can start.
It's up to Dr.
Sounds
Gupta.
good.
You ready?
Yeah,
Okay.
we're
Team? Okay. Well, good afternoon, everyone. I'm Executive Chief Matt Slinkard, and this is a very exciting afternoon with some important partners here with us. And on behalf of our Chief, Troy Fenner, I want to welcome our partners that are here today, especially Dr. Gupta, the Director of the U.S. Office of National Drug Control Policy. And thank you so much for coming to Houston to spend some time with us and with our partners. I'd also like to acknowledge the Special Agent in charge of the Houston Drug Enforcement Administration, Daniel Como. Thank you for being here. Mr. Mike McDaniel, the Director of the Houston High Intensity Drug Trafficking Area, which is our Houston HIDA, which you'll hear more about this afternoon. And also Dr. Joy Alonzo from Texas A&M University, and many other partners that will be introduced shortly. I just thank them for being here today and their continued support and work. But to the reason and the importance of why we're here today, Dr. Gupta has spent the day in Houston with HIDA, with HPD, with multiple law enforcement partners, and a number of area leaders discussing the opioid and fentanyl issues we've experienced just like other areas in our country. Now, we first noticed fentanyl on a smaller scale in 2013, and following a trend in the northeast part of the country, we realized that we would be dealing with this issue. In 2017, we teamed up with HIDA, who purchased Narcan for our officers to assist individuals that were believed to be in opioid overdose crisis. And that has paid great dividends with us being able to save lives and assist in saving lives on the front line with our first responders and try to make a difference and get people the help and the treatment that they need. Beyond that, in 2020, we at HPD formed an overdose investigation squad in our narcotics division, which also has DEA agents and other federal partners working on that overdose investigation squad, which also continues to pay great dividends in us combating this problem with our federal partners. So the Houston Police Department today, we are proud to host ONDCP Director Dr. Gupta and all of our federal and local partners as we work together to combat what we really know is a very complex problem. Now, at this time, it's my pleasure to bring up my friend, my colleague, Mike McDaniel, the Director of the Houston HIDA, who will be followed by Dr. Gupta. Mike.
I'm real happy today to be here, and that honored that Dr. Gupta chose Houston as one of the places to come, and quite frankly, one of the primary reasons is law enforcement, treatment and prevention partners all represented up here today. You have agency, federal, state, and local agency heads here. We're all working together with our treatment and prevention partners to accomplish one common goal. And we're trying to address this epidemic, and we're trying not to do it the same old way. We're actually trying to get all the brightest minds in our community together to address this epidemic that you're going to hear is just ever increasing, and we're sounding the alarms, and we're doing everything we can. And again, I am so honored. Dr. Gupta, as the ONDCP Director, is the right man for the right time to be here, and I'm very honored to have you here, and thank you for your attendance here.
Good afternoon, everyone. Thank you for joining us. I want to thank Chief Matt Slinkard here to invite us and be a great host at Houston PD here, and all the great men and women in uniform that he's leading, and as well as the interagency partners. I also want to especially thank Mike Daniels. The great work that is being done by Houston HIDA is exemplary. Today I'm here and I'm really pleased to announce the $275 million in funding for the 33 regional high-intensity drug trafficking area programs across the United States, including nearly $12 million for Houston high-intensity drug trafficking area program. Now, what are they doing? Well, let me tell you, they are actually working to disrupt and dismantle the drug trafficking and money laundering organizations and reduce the supply of illicit drug in cities like right here in Houston and communities all across the nation. This funding of $275 million will provide additional resources that are critical to the ongoing work of the men and women on the front lines of stopping the overdose epidemic, some from whom I heard about today. These new funds will support their work and will build upon the Biden administration's national drug control strategy that I announced last week. Now, let me tell you why. We are right now facing a crisis of overdose deaths. Latest numbers tell us that we've had almost 107,000 deaths from drug overdose that have occurred up until the 12-month period until November 2021. What does that mean? That means that there's an American perishing to drug overdose every 5 minutes around the clock. Now, this is an urgent priority for President Biden. This is about going after the bad guys and making sure that we are saving lives. So our strategy really focuses on the two big drivers of the epidemic: untreated addiction and the drug trafficking. And it unveils a renewed focus on disrupting transnational criminal organizations and their illicit financial networks and supply chains. We have already brought the international community together recently to control fentanyl precursor chemicals. And President Biden's budget proposal includes substantial increased investments for border security and supply reduction, including about $300 million more for Customs and Border Protection and about $300 million more for the Drug Enforcement Administration. Now, today's funding for HIDAs across the nation will support those ongoing efforts to prevent overdoses and address drug trafficking and related violent crime by, first of all, supporting the illicit drug-related investigations and interdictions efforts nationwide. And secondly, sustaining our investment in HIDA overdose response strategy, which is a unique collaboration with the Centers for Disease Control and Prevention to improve real-time response to overdoses across the nation. In addition, this funding supports new initiatives to reduce the violence associated with drug trafficking, refine interdiction efforts through enhanced data sharing and targeting, as well as dismantle the illicit finance using innovative approaches, including cryptocurrency investigations. And we'll get this done by leveraging the strategic partnerships with federal agencies, academic institutions, nonprofit organizations, the private industry, and state and local law enforcement and investigative agencies. The bottom line is this: we have to hit the drug traffickers where it hurts them the most, and it's their wallets. We got to go through looking at the entire process of illicit financing, including illicit drug trade, trafficking, production, supply chain, financing, enabling of drug trafficking, all of it. Through the President's strategy, we will work to more than triple the number of drug traffickers sanctioned and increase our border security. We'll continue our important work with other nations as well to make it more costly for drug trafficking organizations in every way possible. This work is critical because, let me be very clear, today in America, if it is easier to get illicit drugs than to get treatment, we're never going to be able to bend the curve on overdoses. And that is exactly why, while we work with going after the drug traffickers, we must make sure that we are quickly getting people the help that they need. Why is that? Because the reality is today, only 1 out of 10 people who have a substance use disorders have access to treatment. And that's just unacceptable. The President's strategy will expand evidence-based public health interventions that prevent overdose deaths, like naloxone, an opioid reversal antidote, and increase access to treatment and recovery support services. The strategy also directs federal agencies to work with state, local, and tribal communities to expand efforts to prevent substance use among school-age children and young adults. Because we know that if we invest in prevention when people are young, they are much less likely to develop a substance use disorder later in life. And the strategy also includes specific actions to improve access to medications for opioid use disorder programs in jails, in prisons, and identifying ways to advance racial equity in investigations, in arrests, and sentencing for drug-related offenses while strengthening public safety. Now, our new strategy is a whole-of-government approach, and from President Biden on down, we're all committed to this mission. We're committed to working with leaders from red states and blue states because, you know what, the overdose epidemic does not care about an individual's politics. We know all that. We know that. Now, it's going to take all of us working together to address this new challenge that we face today. And I know that together, through new funding for HIDA programs and the President's comprehensive strategy, we can beat this, and we can save lives. So thank you very much. Now, it's my pleasure to introduce Daniel Como, the Special Agent in charge of the DEA right here in Houston. Dan.
Thanks, Doctor.
Daniel Como, Drug Enforcement Administration, the Special Agent in charge for the Houston Field Division. First of all, I want to thank HPD for allowing us to be here, all of my federal, state, county partners, and especially the treatment community. The treatment community is a big part of this, and it is very welcome, especially from the federal side, that we're teaming up with you guys to take care of this problem, so thank you. Look, the citizens of Houston, right now, you're really in a good place because all of us that's standing up here together is working as one. We're working as one team to really take care of all of Houston and to do our job to put the bad guys in jail, also to get treatment for those who need it, and to work as one to make sure this whole city is safe. The prosecutors are on board from the federal and the county to work with us to make sure we accomplish our mission. Unfortunately, this past year in Harris County, the fentanyl overdose is the leading cause for overdose in Harris County. Fentanyl, something we have to get a handle on. Everyone has to understand that this fentanyl is 100 times stronger than heroin. If you think about it, 100 times stronger than heroin. It can cause an overdose immediately. One pill can kill. And unfortunately, there's so many counterfeit pills out there. And if you make one mistake one day and take one of these counterfeit pills, your life can be over with. This is something that we really have to work on stopping the community from even having access to get them, but also providing the necessary treatment to make sure that those who are addicted can do their very best to get off of it, and also have the awareness out there for you just not to take that one pill. If it's not from a legitimate pharmacy or prescribed by a doctor, just don't do it, because one pill can kill. According to the DEA lab, 4 out of 10 pills, 4 out of 10 of these counterfeit pills will cause an overdose. That's way too many. Way too many. Too many lives are being lost. And right now, look, if you don't hear anything else from anybody up here, just remember that one pill can kill. If it's not from a legitimate doctor, a legitimate pharmacy, just say no and don't do it. Thank you.
Hi, I'm Dr. Joy Alonso from Texas A&M University, and as a member of the treatment and public health community, we are thrilled to be partnered with HIDA, and we were thrilled about the ONDCP strategy released on April 21st, indicating some of the key strategies and innovations that are going to be promoted by the White House ONDCP. They are very well aligned, and we look forward. We need the collaboration of the medical and treatment sectors and public health sectors with the public safety sectors. That is a key collaboration, and we can't be successful without the partnership. Some of the partnerships that we've actually been engaged in with the HIDA in the past 18 months include helping proliferate education and awareness and promoting the One Pill Can Kill campaign. Right now, we're actually making plans to teach the Corps of Cadets at Texas A&M the One Pill Can Kill awareness campaign. Additionally, one of the first naloxone rescue kits, Carry Naloxone, Save a Life billboards, is going to be proliferated in Texas, in the Victoria area and the Houston area, promoting naloxone as a rescue. I know you've heard a lot about naloxone from Dr. Gupta, from some of the other representatives here today. I'm going to show it to you. Every citizen in the state of Texas can have and carry naloxone. And what we're hoping is through this partnership that we can distribute across Texas to everyone, you know, a naloxone rescue kit. I'm going to show you how easy it is to rescue somebody. There's no cap. You just take it out of this foil packet. You don't have to shake it. You don't have to do anything. You put it up somebody's nose. Watch this. You just saved a life. That's as easy as it gets. You know, this is the easiest rescue you will ever effect in your entire life. So we want to make sure the Houston PD, we're thrilled that they have access to this key rescue and key initiative, but we want to make sure every PD, every public health provider, every treatment center, every recovery community has naloxone rescue kits that they can easily provide, that there are no barriers to naloxone rescue kits. Another innovative program that we've developed with HIDA is to deliver naloxone rescue kits to people who are post-incarceration. You are never more at risk for an overdose than when you've just been released from incarceration, enforced abstinence. Additionally, in abstinence-based treatment, you are never more at risk than when you leave an abstinence-based program. It's a chronic relapsing disease state that is going to take every single asset we have, both public and private, to work together in the public health and public safety arena. So thank you so very much. We are thrilled to be here and to represent Texas A&M and University of Texas and the University of Houston, who are all massively engaged in this effort with HIDA and the other state, local, and federal assets. Thank you.
Yeah. So as we wrap up and get into our question period here for just a second, Dr. Gupta, you and your team, I just want to take a special moment and just tell you, you know, I know you've heard from our mayor, Sylvester Turner, who very much wanted to be here with you today but had other business to take care of. But we have a representative from Mayor Turner's office here today as well. And would you like to come up and say something on behalf of Mayor Turner's office? I would appreciate that. Thank you.
Thank you, Chief. My name is Ray Andrews. I'm with the Mayor's Office of Public Safety, Homeland Security, more specifically the Houston Crackdown Anti-Drug Community Coalition. We've had a long-standing relationship with Office of National Drug Control Policy and certainly HPD and many of the treatment service providers here. We look forward to taking advantage of some of the resources that ONDCP will be distributing here among the local community and arming citizens with the information and necessary tools that they may need to use at any given time. And so on that, Dr. Gupta, Mike, and Haida, and the rest of you, we certainly appreciate the opportunity to work with you and look forward to doing that. Thank you very much.
At this time, obviously, we'll open up to questions for Dr. Gupta or any of the other HIDA executive board members or other guests that have joined us today.
I'll leave it up to the Chronicle if you want. 26 doesn't have any.
Yes, I would like to see I mean, if any of you can give a kind of a little bit of background about the evolution of the opioid crisis here in our region, Houston and perhaps Texas also, as opposed to what is more known, which is more, north, east. So how is it, how has it evolved here in the southwest border?
Mike, I don't know if you want to speak on behalf of HIDA. I mean, I can locally for HPD, but if you can probably
No.
handle it as a region for HIDA.
The real simple, the fentanyl and the amazing profit margin for the cartels of getting it here and getting it on the streets. And it is actually so easy to get it in the counterfeit pill. That's our most frequently in times that we've encountered that. But it's the incredible profit margin that the cartels are actually hitting our local region here. And quite frankly, we've got to do something about it, especially as Como was talking about, the one pill can kill, and we're trying to get that awareness. But it's from the fentanyl coming from, the illicit fentanyl coming from Mexico into our region, and it's winding up in the counterfeit pills. I don't know if you have anything else to add, Dan?
Now, look, I want to end on that by saying we recognize how big of a problem it is with all of our law enforcement partners. That's why we're creating these new teams right now as we speak. We're putting new teams out there just to combat this problem. And we're all taking our extremely talented officers and agents from different groups and put them in one group to attack this problem. So this is very important to the law enforcement community and the prosecutors, where we're really taking the stars from other groups just to go after this problem.
Another question for any of you. We know about the opioid crisis, drug crisis, where the opioid is playing so much as a role. But, below the death, there must be who knows how many. Is there any, guess for every death, perhaps such and such, or something to give an idea of it?
Yeah, thank you for that question. In the strategy, and I'll start with the strategy, why that's important, because we have an American dying, as I said, every 5 minutes around the clock. But you should really look at that, the 107,000 deaths, as the tip of the iceberg. Now, beneath that tip is people who are having non-fatal overdoses. And if you look at that sea of non-fatal overdoses, it varies. When I spoke with the governor from Maine, that ratio is 14-1. In states like Michigan, it's 10-1. So it's varying, but what we do know, behind the 107,000, there are millions of people who may be going through the non-fatal overdose. And that is why it's important for us, when we look at the strategy, to look at naloxone saving a life with treatment meeting people where they are, but then not leaving them there. Because one of the things is that for the first time, harm reduction in the history of this nation, harm reduction with activities like naloxone is important to be able to save people and meet them where they are. But at the same time, we have to get them into treatment and they offer the opportunity. But it's also important to go after profits, but also look at the data piece, because I think there's a lot more people with non-fatal overdoses, the second layer of the pyramid. And the last layer of pyramid is probably the widest, which is the people who are suffering from substance use disorder or addiction. The reason that's important is we have less than 1 in 10 people who is getting the treatment that they need. So we have so much of a treatment desert. And the strategy really looks at making sure that we not only provide treatment to high-risk populations, like those behind the walls, making sure that people who are overdosing non-fatally, they're also getting opportunity for treatment, communities of color, and high-risk other populations, but also at the same time making sure that we work to have access for anyone who wants treatment to get treatment by the year 2025. It's a very important in the country as great as ours to ensure universal access to treatment, to be able to get that. That's the only way we're going to be able to get people the help they need, when they need it, where they need it.
Last in that base, I'm really interested in non-death, not overdose deaths, but all the rest, and as you say, the biggest part of the pyramid, those that are suffering addiction. Because quite frequently, I found people that say, I don't believe that. Or say, I read a story and people say, I don't think, that's so rare. And I'm like, no, it's not that rare. I mean, there might be somebody at the corner of your street, but it's difficult to convey that because the image that people have about addiction is, the guy under the bridge, right? So can you please tell something, a message to the average people?
So one of the biggest factors that keeps us in sometimes a stage of not recognizing this as a disease, and addiction is a brain disease that has consequences beyond the brain, obviously, and it impacts individuals' lives, their ability, but also their family and their friends and community and neighborhood. But that's exactly what stigma is. So when we're talking about stigma. We're talking about the importance of making sure naloxone that Dr. Alonso spoke about and others and I have, it is a life-saving tool. We don't have the same feeling oftentimes with CPR or AED because you're saving somebody's life. We need to make sure that this is also looked upon as a tool to save a life, understanding that every life is precious. So I think that's one of the issues is the ability for people to understand that people are suffering from substance use disorder. It is widely prevalent, but we have to recognize and create systems, and that's exactly what the strategy calls for in order to address people's conditions. But at the same time, we also have to address stigma. We have to address inequities in the system, and that's exactly part of what the strategy tries to do. And the work has to be done at the intersection of public health and public safety. And that's where partnerships of groups like HIDA comes in. That's why high-intensity drug trafficking areas, leaders just like those, like Mike McDaniel and his team here in Houston is so important, so vital, because we can no longer afford to work in our own silos. We must break down those silos and work. The public health community and public safety community must work together. So, we have leaders here. It's not by mistake that we have not only leaders from public safety, but also we have public health, we have drug-free communities, folks here as well, Lauren and Pyle, because that signifies the importance of working together.
Okay, any other questions? Okay, thank you very much for your attendance. Appreciate it.
Thank you.
Good job. I know you have a tight schedule. Appreciate it. Absolutely. It was our pleasure. And, anytime you're interested in anytime, let us know. And so, are you in Washington most of the time?
Most of the time, yeah, Washington area, and then,